Good day everyone, I am Anika Denise Balbin, and today we are going to present to you our family care plan. I'll be introducing you to the Dumaguete family. So the Dumaguete family is consisted of two. However, the husband has passed away in 2007 due to a motorcycle accident. Mom Joyce is the only member of the family as they do not have any biological children. So we have her also as the head of the household, and she is 49 years old. Based on our dynamic data, she lives in the barracks of RA Construction, Puting Kahoy, Silang Cavite, and her religion is Seventh-day Adventist Reformed Movement. The type of family is nuclear. According to the Smiltstein's family system APGAR items, they scored a 10, which is interpreted as a highly functional family. So the family function rules, Mom Joyce includes every single role such as the wage earner, the person who earns money, financial manager, the one who supervises the family's finances, and the problem solver, the one who provides solution to the problems, decision maker, the one who makes decisions such as in lifestyle and leisure, and lastly, the gatekeeper, the one who is appointed to decide what relationship is acceptable between the parent and children. Although Mom Joyce lives alone in the barracks, she treats her co-workers, friends, and pets as her own family. So the family is matriarchal because Mom Joyce is the head of the family and she is the only member. So for the home and environment, the Dumaguete family currently lives in the barracks of RA Construction, and the construction materials used are makeshift of sturdy metals and wood, which is used as a divider for her room and comfort room from the living room to the connected warehouse. So the barracks consist of one room for sleeping and one comfort room. So their source of electricity or their lighting is Meralco, and for the source of drinking water, Ma'am Joyce stated that it is from a nearby water station in which it is easily accessible and the waters are stored in gallons. To proceed, the appliances they own are a refrigerator, an electric fan, a washing machine, and a dryer, also a television and laptop. So they use a gas stove for cooking and food preparation, and as we have observed, their food preparation is moderately clean, and for their waste disposal, their biodegradable waste, such as fruit peels, are thrown to the garden as fertilizers, while their non-biodegradable products are piled up and incinerated or burned. Moreover, they have a private toilet and their drainage systems are closed or covered.
For the family health status of the Dumaguete family, some common illnesses that Ma'am Joyce experienced in the last 6 months include common colds, headaches, and cough. She does not take any medications even for headaches. Her treatment relies more on naturopathy, resting, and coping with stress through planting. For the family's dietary recall, Ma'am Joyce mentioned that she had adobong kangkong for breakfast, nothing for lunch, and pineapple for dinner. She weighs 48.45 kilograms with a height of 4 feet and 9 inches with a BMI of 21.82, which is interpreted as within normal. During the first visit, her vital signs are 36 for temperature, pulse rate 96 beats per minute, respiratory rate is 91, blood pressure is 130/90. Vital signs during the second visit is 36.4 for temperature, pulse rate is 100 beats per minute, respiratory rate is 21, blood pressure is 120/90. For the third visit, 36.3 for temperature, pulse rate is 97 beats per minute, respiratory rate 28, blood pressure is 130/90. She is farsighted and uses prescription glasses and scored 20/100 for both eyes in the visual acuity test. However, she is able to see more visible in the left eye. Eyes are equally reactive to light and dilate at 3. We also tested her blood glucose and uric acid levels 2 hours after meals. For the test in the second day of assessment, she had 5.5 uric acid, which is within normal range, and 294 for glucose, which is interpreted as severely elevated. The second test was done last Monday, July 3, 2023. The uric acid was 5.2, which is still within normal range, and 334 for blood glucose, which indicates severely elevated. The last test was conducted on July 5, in which she had 3 for uric acid that indicates low, and 272 blood glucose that indicates severely elevated. For past health history, she was hospitalized in 2016 due to flu associated with coughing and was diagnosed with allergies. In 2016, she was hospitalized due to a cough that lasted for 5 months and was diagnosed with an allergy. She also reports not menstruating for 2 years. Last August 2022, she sought her provider's advice and underwent a laboratory test. No problems were found, and the provider told her that she is yet to menopause since her uterine lining is still thick. Moreover, she also mentioned having occasional cramps on her abdomen, leg, and back, and used a blower to hit her abdomen down to her lower extremities. Aside from that, she has a sedentary lifestyle and often focuses on work. For family health history, her father has hypertension, kidney problems, and is diabetic. And her mother also has hypertension. She also experienced 3 motor accidents in the past, in which she did not undergo laboratory tests to check for fractures.
So for the ranking of health problems in the family, we have 4. For the first one, we have hyperglycemia as health deficit. And second, we have leg and back cramps as a health threat. 3 is work-related stress, and it is classified as a health threat. And the fourth and last one is a previous history of URTI as a health threat. So based on the ranking of health problems in the family, the first priority is hyperglycemia, which scored 3 and 3 over 5. And the second priority is a leg and back cramps, which scored 3 and 1 over 5. Third priority, we have the work-related stress, which scored 2 and 4 over 5. And the fourth priority, we have the previous history of URTI or upper respiratory tract infection, which also scored 2 and 4 over 5.
So now we are done with the first level assessment. Let us now proceed to the identified problems. And the first one is hyperglycemia as a health deficit, as it belongs under its category of illness states, regardless of whether it is diagnosed or undiagnosed by medical practitioner. And according to the typology of nursing, it is the ability to recognize the presence of the condition due to lack of or inadequate knowledge. So based on the scoring and the concern of the client, hyperglycemia is an important issue to focus on. According to the client, she stated that she is fond of sweets and she has a high blood glucose level. Based also on her family health history, the client's father have diabetes. For the cues, we have the subjective and objective data. During the second visit, we started monitoring her blood sugar level. The client's test result for day 2 is 294. For day 3 visit is 334. And during the last day, her blood glucose decreased compared to day 2 and day 3, which is 272.
So for the second identified problem, we have leg and back cramps related to prolonged sitting and inadequate exercise. So this problem is a health threat as it belongs under its category of unhealthy lifestyle and personal habits or practices, specifically lack of or inadequate exercise or physical activity. And according to the typology of nursing problems, they are unable to make decisions with respect to taking appropriate health action due to low salience of the problem or condition. In other words, it is not seen as an important issue to focus on. So, according to the family, they are not able to do as much physical activity due to their nature of work. And I am observed that the client did not much emphasize the problem and set aside the issue of leg and back cramps. They have been more focused on their blood glucose levels, blood pressure, and work-related stress. So for the ranking, it's scored 3 and 3 over 5. For the cues, we have the subjective and objective data. But to summarize everything, Mom Joyce verbalized that she has a sedentary lifestyle due to work, and she experiences occasional cramps at her legs and her back. Moreover, she experienced cramps while overstretching her muscles while lying in bed, and she also mentioned having a lack of exercise. Aside from that, we observed that she has a poor posture while sitting down and experiences prolonged use of laptop and eats irregularly. And that is for our objective and subjective data.
For the third identified problem, we have work-related stress. So this is considered as a health threat, which is the inability to recognize the presence of the condition due to busy schedule and work, lack of or inadequate knowledge, and inability to provide inadequate nursing care to the sick, disabled, dependent, or vulnerable at-risk member of the family due to lack of or inadequate knowledge about the disease or health condition, inadequate family resources of care, specifically the absence of responsible family member. Ma'am Joyce stated, "Ako in charge sa construction warehouse at nag-work ako from 6 to 5. She also stated that her stressors are her co-workers. The client experienced headache when she is stressed, and based on her vital signs, she is pre-hypertensive, and that is one of the causes of stress."
So for the fourth identified problem, we have the previous history of upper respiratory tract infection. This is classified as a health threat as it belongs under the category of health history, which may participate or induce the occurrence of health deficit. And according to the typology of nursing problems, they are unable to provide a home environment conducive to health maintenance and personal development due to inadequate knowledge of preventive measures and lack of or inadequate knowledge about the disease or health condition. So, according to the family, they were hospitalized in 2016 due to persistent cough and accompanied by flu-like symptoms, which worried them and thought it was due to pulmonary nodules or spot on the lungs. They consulted a pulmonologist, but the provider stated that it was just allergies. The client also stated that there is no recurrence, and aside from that, they have inadequate knowledge regarding the disease, as they mentioned that they did not know what kind of allergy or what allergens caused it and forgot what was prescribed to them. Another is that she is prone to various allergens such as fine dust cement and others in the construction warehouse. She often burns non-biodegradable waste also without the use of PPE or masks. She also often lacks sleep and rest and has irregular meals. So the problem scored a 2 and 4 over 5. And that is it for the subjective and objective data of identified problem number 4.
For the intervention plan of hyperglycemia, the goal for this is after the nursing intervention, the family will have adequate knowledge about high blood glucose or hyperglycemia. Objectives of care. After the nursing intervention, the client will be able to understand and apply ways to lower blood glucose level. Next is to verbalize how to maintain a diet that is high in fiber, low in sugar and carbohydrates. To verbalize the importance of exercise to avoid a sedentary lifestyle. Last is to state the importance of self-monitoring of blood glucose.
So for the nursing intervention, we will monitor the vital signs, assess for factors that result in leg and back cramps, discuss with the family the causes, effects, risk factors, and treatments for leg and back cramps, explore health promotion behaviors that patient is willing to incorporate into lifestyle, instruct the client with the use of hot and cold compress, demonstrate stretching or exercise and proper posture, identify leg and back muscles that are usually affected by cramps, and monitor and keep in touch with the client, as well as promoting an active lifestyle such as low-intensity workouts.
The intervention plan for work-related stress. After 30 minutes of nursing intervention, the family will be able to gain knowledge about stress and how to lessen it through relaxation activities and deep breathing technique. Objectives of care. After the nursing intervention, the clients will be able to know the importance of managing stress, demonstrate deep breathing technique, and acquire adequate information about the disease, including its signs and symptoms, immediate health care assistance, and preventive measures.
So, for the intervention plan of the previous history of upper respiratory tract infection, the goal is after 30 minutes of nursing intervention, the family will be able to gain knowledge about URTI and demonstrate knowledge and observe preventive measures. So, for the objectives of care, after the nursing interventions, the client will first acquire adequate information about the disease, including its signs and symptoms, immediate health care assistance, and preventive measures. Second is to gain knowledge to reduce the chances of acquiring and spreading communicable diseases to other family members or co-workers. Aside from that, we need to demonstrate preventive measures and apply use of home treatments and eliminate and recover quickly from the condition and prevent URTI in case of recurrence.
So for the evaluation plan of hyperglycemia, I evaluated through interviews and observation, teach back method, demonstrate knowledge regarding hyperglycemia, and applying treatments and preventive measures such as maintaining a diet that is high in fiber, low in sugar, and carbohydrates.
For the evaluation plan of leg and back cramps related to prolonged sitting and inadequate exercise, first we need to conduct interviews and observation to the client if the client well understood the patient teaching, and then we need to allow her to teach back to us what information retained to her. And aside from that, we have the online test, which is a 12-item test, and demonstrate knowledge regarding leg and back cramps. She also needs to demonstrate application of treatments and preventive measures, as well as verbalize less occurrences of leg and back cramps and demonstrate a more active lifestyle.
For the evaluation plan of work-related stress, I evaluated through interviews and observation, teach back method, demonstrate knowledge regarding stress, and identify stressors, and also applying the importance of doing relaxation activities and deep breathing technique. And last, having a healthy lifestyle such as exercising, eating a balanced diet, and having adequate sleep and rest.
And lastly, for the evaluation plan of previous history of upper respiratory tract infection, we also have the interviews and observations, as well as the teach back method of what were the information that retained to her during the patient teaching of URTI, as well as the online test, demonstrate knowledge regarding upper respiratory tract infection, demonstrate application of the treatments, and verbalize observance of preventive measures.
Being a community health nurse is challenging yet fulfilling experience. In our 4-day community visit, we encountered difficulties and challenges throughout the process of creating a family care plan. In conclusion, the Dumaguete family is a Seventh-day Adventist Reform movement nuclear family who is single and living alone in the barracks of RA construction site in Putingkay, Silang, Cavite. Joyce Dumaguete is a 49-year-old widow, no biological children. The identified problems were hyperglycemia, leg and back cramps, work-related stress, and upper respiratory tract infection. Nonetheless, our client greatly helped us with her utmost cooperation, compliance, and warm welcome throughout the community visits.